called Public Health is Everyone's Business, Make It Yours. And the reason why I gave it that title was because, you know, public health has become very popular over the last few months, no surprise, because of COVID-19. We thought it'd be really good to have a conversation about what we do rather than our courses, because we have information on the web about our courses. I'm going to introduce you to 3 lecturers who are joining me today, and you'll get to hear about what they teach, their research interests, and it'll give you a taste of the exciting debates and discussions that we have in our module. I'm going to call on each one, and I'm just going to ask them to tell us a little bit about who they are, how long they've worked at the university, perhaps a little overview about their teaching portfolio and their research skills. Chris, to start.
Is that because my microphone's
yes,
still?
I just thought it'd be easier.
Okay, that's fine. Hi, I'm Chris Lyle. I've worked at the University of Wolverhampton for approximately 20 years now. My main interest is in issues around social issues to do with public health, which is, as Ranjit said earlier, very topical at the moment. I'm also very interested in issues around domestic violence and any aspect of interpersonal violence, again, which is a very topical topic just at the current situation. I've got a background in mental health, again, topical issue. And my sort of research skills and background have been largely around the domestic violence issues, and also I'm more of a qualitative type researcher in that I'm interested in people's views and experiences and how people think about things. I've done quite a lot of detailed research into things like why women don't follow through with complaints to the police about domestic violence, done a lot of work about courts and the criminal justice system. I've done quite a lot of work around also interpersonal violence and issues to do with bullying within universities, and presented a paper over in Sydney about that a couple of years ago. I'm actually quite grateful it was a couple of years ago, so I wouldn't have been able to go if it had been this year, so I would have missed out on seeing Sydney. So I teach mainly on the Masters in Public Health. I'm the award leader for that course and have been for some time now, so have a lot of experience in all of those areas.
I'll now call on Dev to give us a brief overview.
My name is Dev Acharya, and I'm the senior lecturer in Wolverhampton University. I joined Wolverhampton in January 2020, just a couple of months ago, 6 or 7 months ago. I was a lecturer in Aberystwyth University for the last 5 years. I started teaching as a lecturer from 2015 until the end of 2020 in Aberystwyth. Before that, I worked at the University of Aberdeen as a project assistant in epidemiology group, nearly 2 years. I think from 2008 until the end of 2009. My area of expertise is sexual and reproductive health, mental health, teenage pregnancy, women's autonomy, especially in the developing countries. Particularly focusing the young people, because I was conducting research. My research was mainly focused around the sexual health, the effectiveness of delivering sexual health information to the young people in South Asia. But my MSc dissertation was mainly focused in looking at the parent and pupil involvement in sex education, curricular development in Scotland, in Scottish schools. That was a partnership between the University of Aberdeen and NHS Scotland. So both knowledge from the UK and international perspectives, looking at both aspects. During the course, I had a great time to present my findings in different countries, such as the first, when I was working back in Nepal, but originally I'm from Nepal. So working among the different kind of people promoting sexual health, I had an opportunity to present the oral presentation in Kobe, Japan in 2005. After then, I visited Bangkok to give another presentation in India, in Canada, in Finland. So different kind of papers I have presented over the last couple of years. So what I would say that if students are interested in getting in touch with this kind of topics in a wider health issues, I'm very happy to help students, and mainly the anthropological, sociological aspects of the health. It's how do we link the public health with the sociological and anthropological lifestyles of the people. That's what my interest is. Yeah.
Brilliant, thank you, Dev. And I'm moving over to Ratnakar.
Thanks, Ranjit, and hi everybody. I'm Ratnakar Andugula, and I welcome the participants, for their interest in the public health, and I congratulate them, for choosing public health. So a little bit about myself. So I'm a trained medical doctor, and then I worked as a primary care physician, and then while working as a primary care physician, I was dismayed by the inequalities between the rich and the poor, and the literate and the illiterate. I was drawn towards public health. So I was more interested because I thought, as a clinical medicine specialist, I was only addressing the needs of an individual rather than the community. So when I thought the root causes of the health problems and health issues, so I was more interested towards preventive medicine. So then I did my Doctor of Medicine in Social and Preventive Medicine. And within that specific field, I was more interested in the social determinants of health, where I was exposed to the social determinants of health. Then I realized that health is not only, the ill health is not only as a result of the genetic conditions, mostly depends on the social conditions, like, the housing, the area where you live, and, the environment. So I was more interested towards that. And then, I worked as a primary care physician, and then after moving to the UK 15 years ago, then I did my master's in public health, and then I worked in the NHS Northeast Essex. I worked with Public Health Wales, and I think now everyone is familiar with the World Health Organization because of the COVID. So I worked in the World Health Organization for the polio surveillance project. So I was, I worked, I had enough experience both in the developing as well as the developed worlds. And also I had a few courses in the United States. So I had a bit of, familiarity with both the developing countries and the developed world, and within the developed worlds, a few different countries. So I think, it is all just because of, the public health, because, it gives you a vast opportunity, to improve your skills, because everything, if you see whatever happens, they all come under the remit of public health. Take for example, education. So whatever topic we choose, it somehow or other it fits into public health. So I think public health is a great discipline, all along these years. But still, because of COVID, I think the profile has been raised, like anything. And my research interests are anything related with clinical medicine or inequalities. As I said, we have a wide remit. So I think the potential is enormous, and the opportunities are huge. So that's a brief introduction about public health.
Thanks you. Thanks for that, Ratnakar. And I totally forgot that I don't think I introduced myself, so people don't know who I am.
Yes, I did.
So I'm Ranjit, and I'm a principal lecturer and head of department for public health studies is what we're calling it, because we offer public health and we offer health studies as well. I've been at the university since 2001, so I know I don't look that old. So it's a long time, actually, almost 20 years. And I came from working in public health promotion, working in sexual health, community development roles. But prior to that, my first degree was actually in Russian studies. So I studied Russian language, history, politics, and that's where my interest in health came, actually. And that's why I moved into sort of public health work. I don't do as much teaching now, so I mainly supervise at master's and doctoral level. But my areas of research, my interest in sort of research is around public health promotion, needs assessments, leadership. And for my doctorate, I did a study looking at prisoner public health. So I looked at prisoners, their public health, and how that could be improved through the use of drama. So I'm also a writer for stage and screen. So I was very interested in that sort of creative approach to addressing people's health and well-being. So I'm interested in the use of arts in health, how things can be evaluated, and how you can talk about the impact and the outcome of projects and initiatives, because I think that's really important. And I'm very interested in the health and well-being of people from Black and minority ethnic communities, and also from other communities that sort of have issues that haven't really been addressed that much. So I have the pleasure of overseeing the department, and it's a very big department. We've grown over the last 10 years in particular. Public health has become very popular. So we've grown from a department of around 10 staff, 10 academic staff, to now it's around 20. We're one of the biggest departments in the country in terms of student numbers as well. But the one good thing is we have, as you can already see, we have a diverse range of people who teach students and have a lot of interest that they bring to the course as well. You can find out about our courses from the website. So if you go to www.wlv.ac.uk/public health, you can find out about each of our courses there. It's a very comprehensive overview of our courses. We've also got a news blog, and we've also got individual profiles of members of the team here, but also the other 16 people in the team. You'll see profiles of them. And you can also follow us on Twitter at publichealth_UK. You can follow me on Twitter at Dr. Kutan. I don't know if anyone else has a Twitter profile. I'm looking at others. Oh, Dev, you've got a Twitter profile.
I've got.
Yeah, what's your Twitter?
Yes, I can see your tweet.
Oh, so we're friends. That's good, because that would be a bit bad if we weren't following each other. So what we're going to do in this session is we're going to take some questions from people who are joining us. And I'll just have a quick look to see if there's any questions. None at the moment. So ask your questions. We're not going to pick on you. We're not going to ask you to go on screen. It will just be things that we can then talk about. So any questions you want to ask us, that's fine. But I'll just start that off by just talking about sort of health issues. We know, and some of you have mentioned about COVID-19 being, on everyone's minds over the last few months, and it's dominated the news, and it's created a lot of interest in our courses. And what I think has been really positive, I know it's been very sad that it's been devastating for individuals and economies across the globe, but it's given people an understanding of what public health is. And public health is so broad. I think Ratnakar, you mentioned that everything is related to public health, really, and it has an impact on our lives in so many ways. So what would you say, and I'm going to go to each of you now, but what would you say are the other important health issues that need to be dealt with, and why? Because some of these things are being forgotten, aren't they, over the last few months? So what sort of other health issues that relate to public health or health studies, health and social care, are important? So I'll go to Dev first.
Right. Okay. So as I said, it's my interest, sexual and reproductive health, the mental health, the other health issues, particularly looking at among the young people. But the thing is, the main thing is we need to see the health as in a holistic approach. We can't set one health issue and that's a different one. As soon as we figure it out, it is linked with something else. So we need to figure it out. Let's say the sexual and reproductive health. So why there's an issue? Why we see that the teenage pregnancy, the number of the people having the girls are more pregnant. The rate of the teenage pregnancy going high. What could be the reason? Is this linked with the socioeconomic status? Is this the family structures? Is this the mental health issue? Is this with the employment? Is this with the education? So there are many issues, but the thing is we need to figure it out. There is not only one component. There are many components associated with one public health issue, one health issues. So taking the health as a holistic approach, for that to know, to understand, we need to have a lot of information to know the background, why this is happening. So if I could see that the mental health issues, the stress, let's say the COVID-19, that there are many literatures, many research has been carried out looking at why there are an issue, why there are many people with the mental health issues because of the COVID-19, why children are staying at home and then just spending a lot of hours and time just playing with the games, with the computers, with the internet, and no access to other activities, going outside, playing in the football ground, meeting to the people, seeing to the other friends. So there are many complications because of one thing, let's say that the COVID-19, why this is happening and what could be done. So one thing is the problem is there, and what could be the possible ways forward to look at what could be done to prevent this, to control this. So either it's a prevention and control from the family perspectives. It could be the family, maybe the family may not know the information how to tackle these issues at home. Let's say when the kids are at home playing with something, engaging in the games and internet, what could be done? So the family may need kind of information or educations. They may not be aware about that. There are a lot of things going in and around. So they may need a specific information. Maybe there are barriers to that information in education. Maybe they speak different language. The information is there with the other language. So the barriers is that the language is the barrier. Could be the language is the barrier. Maybe the culture is the barrier because something is not adopted in that particular family. That is not practiced in that particular family. So maybe the culture is the barrier. So we need to figure it out. Why for some families, some information, some message can work, while for other family, it doesn't work. But we need to see that why this is not working and why this is working. So that's one approach of finding out what is the best possible ways for, and one doesn't fit for everyone. That's a major thing. One information doesn't fit for everyone. So that means we need to adapt. We need to modify the information or any service, could be the service as well. So that is important. That's why it's a little bit complicated to figure it out. If we live in a community with different kind of people living or in a society, so we need to see that which community, which family needs what information. That is the important aspect. That's why in some community, in some family, you see that something is working while other people have a high not getting that information. For example, here we see that why the Black and BEM group, Black and Asians and other ethnic communities, ethnic minority people are worstly affected by the COVID-19. Why this is the case? What is the reason? What is the root cause? Why this is happening? The government is giving the information. There's a plenty of information, but why this is happening? So we need to find out the root cause. As we said, there could be the many regions. It could be the cultural barriers, the language barriers, it could be the socioeconomic status. Maybe some people are not employed, and maybe because of that, they don't have the proper diet. And, yeah, so there are many ways. So we need to figure it out.
Yeah. I can see you're very passionate about that. You've covered quite a lot of areas. And I mean, it just shows the complexity, doesn't it? A simple issue that we may see as simple, it is complex. And that's why some of these things that we're still dealing with in public health haven't been dealt with because of the complexity of people. and you know, we're dealing with changes all the time. So, but thanks for that, Dev. I'm going to pass over to Chris and Ratnakar just for a very quick answer. So just, you know, what are the other health issues? You don't have to go into so much detail, you can just list them if you wanted. So maybe Chris first.
Yeah, I mean, again, it has raised a lot of other issues. I think Dev has touched on quite a few of them. I think it's also highlighted issues certainly around people's mental health, as we're very aware. Lockdown has been very destructive for a lot of people. It's had an impact on rough sleepers and homelessness. And whilst, you know, there have been strides for the government to address that in terms of opening up hotels to rough sleepers, that's now come to an end. But unfortunately, people living on the streets hasn't. So in some respects, that is still a massive problem, which hasn't really fully been addressed. And as I said earlier, issues around domestic violence has risen considerably during the lockdown period. So those are just three of many I could mention that have had far-reaching effects on people.
Thank you. And Ratnakar, have you got anything else to add? Any other issues, questions?
Yeah, thanks, Ranjit. Yeah, you know, like Dev and Chris have covered, you know, most of, you know, the important aspects or the important, you know, public health problems which are, you know, happening right now. So, but, you know, because they have touched some of the most important, you know, aspects. So I thought, you know, I would touch upon, you know, the communicable and non-communicable diseases. And again, you know, if you look at, you know, the global perspectives. So, you know, apart from COVID-19, you know, there are still communicable diseases. You know, for example, again, you know, COVID-19 is again a good example of this, you know, this infectious disease. So we still have, you know, apart from, you know, the smallpox, we still have diseases. None of the diseases have been eradicated. You know, for example, polio. Take for example polio, which was on the brink of extinction, but still, you know, again, you know, due to disruption of the health systems, again we are seeing, you know, resurgence of the polio. And also, for example, we see all the vaccine preventable diseases. Again, you know, they are making a comeback. Again, you know, you find new diseases like COVID. Again, you know, there is re-emergence. So, you know, you see, if you see, you know, on the one half, you have communicable diseases. On the other half, you have the non-communicable diseases like, you know, cancers are on the rise, you know, diabetes, you know, hypertension and stroke, you know, myocardial infarction. So you have, you know, wide range of diseases, and you can see, you know, differences both nationally and internationally. You can see those glaring differences, you know, on each of the diseases. You know, this is all in kind of a nutshell.
Yeah, thank you for that.
Thank you.
Thanks for that, Ratnakar. And it's really interesting because I think what you've highlighted is some of those, and this is what we wanted to do in this session, was some of the complexities of these health issues, but things that we're all thinking about, you know, and we're hearing about over the last few months. You know, we've heard a lot about COVID-19, but alongside of that, we're hearing about, you know, people not being as physically active, you know, eating more. So obesity is on the rise. And then now we've got this, the Rishi deal, where you can get 50% off your meal, you know, at Mondays, Tuesdays, Wednesdays. And, you know, it's that sort of contradictions that are happening. And, you know, we're dealing with that in health. How do we deal with those challenges that, you know, that come from policy, so come from government, and then you've got to deal with people's behavior as well. So we draw on things like psychology quite heavily and educational theory in what we do. And that's what's really exciting, I think. And that leads me, we actually have got a question. So somebody's asked, how can, and it links in quite well with this, how can public health professionals ensure that the right section of society engages with an important health promotion, for example? Or do you have to just accept that you can't reach or engage with everybody? Frustrating, question mark. So this is about sort of, how do we reach everyone, you know? And I think, Dev, you touched on something around, you know, BAME communities, Black and minority ethnic communities, or those communities that are hard to reach. Chris, you talked about sort of homeless or rough sleepers, those sort of people. So any suggestions? How can we sort of, work with groups that are, how can we engage with those groups effectively? Maybe if you put your hand up and then I'll come to you. So who's interested in starting this one? So Dev first. Okay, so off you go.
Yeah. Yes, this is genuine issue. And the important thing is, unless we know where is the problem, no one can fix it, because people should know that where is the problem. Let's say for the BAME community, why? Because there's a figure, there's a number, why BAME people are dying because of COVID-19. The percentage is very high. Why this is happening? And the first thing we should know that these communities are dying because of COVID-19. The first thing is that the information to dig out. So if, let's say in a community, a certain group of community is deprived of something, of the information, or maybe the services, the health services, or the medications, first we should know about that. So if we know that this is happening, that the cause of the problem is that, only then we can think of that. So the first thing is to know about the information, to know about the issues. So who brings that issues up front? So that is the issue, because there are many issues, there are many problems, but some problems are in the horizon. Some people can see it, but there are many which people can't see it. So the first thing is we need to bring it. Let's say there are people, the reporters are there, the journalists are there, or the researchers are there. So the thing is we need to figure it out, and then only then we can see it, and then we can find out a possible ways forward. I think that's the best way of getting the answers for these questions.
Excellent, thank you, Dev. And Chris just wants to jump in on that.
Yeah, slightly disagree with that point of view. I understand that obviously there are hard to reach communities and the information doesn't get to everybody. However, from my own experience of living through this over the last few months, I see people who are extremely well educated, have clearly got access to the information, because it's very hard to avoid it. If you've got a TV or a radio or a computer, or you don't live under a stone somewhere, and yet people still choose to ignore the advice that they're given. For example, I live in a very nice rural area, which is a farming community, and I can assure you that farmers take absolutely not one jot of notice of of the information that is handed out. And this is not a BAME community. This is a rural area with some, very, as I say, educated people who you can't use that as an excuse for. So I think, going back to your point, Ranjit, about psychology, I think there's clearly different issues around what motivates people to follow advice. And the example I always give when I'm teaching around this area is, why do people carry on smoking when it is blatantly obvious that it's bad for you? And yet we still have a major smoking problem. So it's not lack of information, it's not lack of education, it's more to do with people's mindset and motivation.
And that's frustrating, as one of the audience member who posed the question said. So Ratnakar, you wanted to add something?
Yes, Ranjit, thank you. What I want to mention in specific, to the question is, the participant was asking, like, do we need to leave people, with the information, or how do we, go about that? So in relation to the specific question, if I take, for example, my own experience working in one of the most, deprived areas in Northeast Essex, which was a couple of years ago, was, the #1 ranked most deprived area. So it's like, once you know the problem, there are mechanisms in place as far as the government policies are concerned. So you have the right people, but the thing is, you need that kind of an engagement. Once you know the information, through statistics, where you have statistics at the the government publishes statistics, you have statistics from the local government authorities. So you have non-governmental organizations. So once you pick up that information, depending upon that particular policy or a particular problem, as public health professionals, we need to engage with those communities. Even ethically, you cannot leave them. So you need to engage and then see what best is available, what policy options are available, to address that particular issue. And there are options and policies and procedures in place, for all the issues we can think of. So I think I could answer a little bit of that particular question at this point of time. Thanks, Ranjit.
Thank you for that. I mean, I just reflect on my own experience working with different communities, and it was a long time ago, but we still, all of us actually engage in some sort of work still with different areas. And one thing I remember was working with a very deprived community in an area in Birmingham. And the frustration was that we had services, health services, and we just wondered why people, weren't using the health services. And, we were focusing on sort of outreach work, going out to communities and giving them the information. But I remember somebody saying at the time was that, what is it that these communities, what is the barrier for them accessing our services? So, and when we asked them, they didn't feel that those services were for them. And it was a real shame, because those services were for everyone in the community, but we weren't making them appeal to this group of people. So people felt as if when they walked into their health centre that they didn't belong. And that's what they said. They said, we don't belong there. And that was a real shame. They pay their tax the same as everyone else. It's, that service is available to them. And that was the thing. It was to get over that mindset that is for them. And it's the same with health promotion. And what Chris said was about this behavioral psychology, which you've heard a lot about, is how do you change people's mindset? So Chris, you want to jump in again?
Yeah, I just say I totally agree with that. And I think it's, whilst I'm perhaps looking at the other end of the social spectrum in terms of, I think we tend to talk a lot about underprivileged and deprived areas and social deprivation. Of course, public health problems affect everybody, not just one part of the, they're not just down at that level of society. But I think also having worked in deprived areas as a mental health nurse many years ago, I think there's a real danger that public health professionals can be a little bit pious and a bit self-righteous about their message to people. And it's like you say, it's not for everybody. It's this them and us sort of mentality, I think, is what separates people engaging with services and not. And it's very important that they are accessible and that services are there for everybody, but without going out and preaching at people and telling people what to do. And I think there's a bit too much of that goes on in public health in terms of instructing people, telling people what's right and what's wrong, and making it something that is difficult for people to feel that it does apply to them. So I think public health professionals could learn a lot from just being a bit more human, rather than going out sort of saying, this is how much you should weigh, this is what you should eat, this is, you shouldn't smoke. You're not going, that's what you go to your GP for, isn't it, to be told what to do. And look, we know that doesn't turn out well in many cases, because people don't like being told what to do. So it's I think one of the barriers, even in every strata of society, is the approach that you take. It should be something that people want to do, not feel that they ought to do. And I think that applies to everybody across society, whatever aspect of society you live in.
That reminds me of when I worked in health promotion. we had a phrase which was, spray and pray. So you spray that information around and you pray that people take it on. So, and it's that thing of, you know, it has to have that human element. You've got to understand the community you're working with. And as you say, Chris, everyone has these issues. Everyone needs to be worked with in a different way. Now, I know Ratnakar and Dev wanted to jump in as well, so I'll let them say something.
Yeah, Ranjit, I just want to, you know, add to what, you know, Chris has mentioned. I want to specifically, you know, talk about two issues. You know, one, you know, while she was mentioning, you know, giving the background of the rural community, she specifically mentioned, you know, they are not BAME people, you know, they are farmers. Yes, so we hear that, isn't it? See, it's not only, you know, those BAME communities, you know, there are hard to reach people, you know, the rural communities especially. So, you know, we generally hear the phrase, you know, as you said, you know, spray and pray. So we also hear that, you know, they asset rich and cash poor. So, you know, we need to take those into consideration as well. So it's not only the BAME communities, you know, there are many people, you know, in the rural communities, you know, where they are being, you know, denied access for the, you know, the services, the internet, and we need to, you know, look at those aspects as well. And the other point which I would like to mention is, you know, in relation to, you know, Chris's point is, you know, the ethical aspects. See, as public health professionals, we have many public, you know, ethical frameworks. So, you know, for example, we can use, you know, CAS ethical framework, you know, in relation to, you know, the public health program. So we have we are guided by those principles. So I think as public health professionals, we can use those frameworks, you know, to see that, you know, we are delivering, you know, ethical, you know, delivery of the programs. So I think, you know, these are the 2 points which I would like to add to, you know, Chris's points, please. Thank you, Ranjit.
Okay, over to you, Dev.
Yeah, just want to summarize. I know these things are correct in the perspectives where we take it, as Chris highlighted, as Ratnakar has highlighted. I think the gist is who need what. Someone needs information. Someone needs the attitudes to be addressed. Someone has the behavior. So KABP, we take it as summary. Knowledge, whether people need knowledge or the community needs knowledge, information. In some community, they need it. Some communities' attitude is very wrong or very right, or some attitude needs to be addressed. Or the behavior, as Chris has highlighted, they know the first stage, they have the information, but the behavior is not following what the information is. So the behavior is not following what people know. Smoking is injurious to health, but still they smoke. The behavior pattern and the practice, how do people are practicing it. So the knowledge, attitude, behavior, practice, we need to figure it out what people need, either the first one, the knowledge, or the behavior, or the attitude, or practice, whatever it is. So based on that, we need to figure it out. And it fits with the public health knowledge. KABP fits with the public health aspect. It fits in all these stages. We need to figure it out. What information or what knowledge or what behavior or what intervention is needed, looking at what stage. So these are the important things we need to consider. And then we, as we discussed, Chris has highlighted, Ratnakar has highlighted, we all agree upon that. I think so.
That's great. Thanks for offering that, Dev. And I think that's one of the great things about our course. We provide people with a lot of these theories that you can hang your existing knowledge on already. Because sometimes I said to students, you know this already. You've just got to try and understand. You see this happening around you. We're just opening your eyes to it and understanding how you can work with communities, groups, populations to help them improve their health and well-being. So Sharon, who asked the question, has said thank you to everyone. It's certainly complex. It is. It's made me realise it's complex, and she said that she's hooked. So that's a really positive thing. So that's good. I do hope you're joining us on one of our courses, or if you are still considering your options. I just wanted to mention that we are available. If you go to the university website, wlv.ac.uk, you can find full details there. So that's great. So Sharon is coming to study with us. She's doing a social care and health degree. So that's brilliant. So, okay, I'm just conscious of time. We've got a few minutes left. Now, clearly, one of the things that we've all said when we gave our overview is that you could tell that we all love working at the University of Wolverhampton. I mean, Chris and I have been here a long time. Chris, I don't think you mentioned how long you've been here, but...
Yes, I did, 20 years.
Oh, did you? Okay, so I thought it was a little bit longer, actually.
Thank you. It's my grey hair.
Well, we've known each other a long time, but it's gone by in a flash. So we obviously love working at the University of Wolverhampton. But from your experience working with students, what do they love about the University of Wolverhampton? Maybe just a minute each, if there's things that you could say, and include your tips in this as well. Any tips for being a successful student at the University of Wolverhampton, specifically on one of our courses. So I'll go to Chris first.
Yeah, my top tip would be to fully engage in what we offer. I know things are slightly different at the moment, but we are still accessible. I think we're a very approachable team of professionals. I think the students that do well get to know us, and they work hard in terms of using what's available, and being familiar with the resources that we have, because there is a lot to offer people, a lot to offer the students. And I think the thing that I enjoy the most is that interaction and engagement with the students and getting to know them, and enjoying their learning process. Basically, I like to teach, and I like to know that students are learning and enjoying their learning. So my top tip would be, in a nutshell, come and enjoy yourself, enjoy what you're learning.
Brilliant, thank you. That's a great tip. Dev?
What I would say that for the students, this is a great opportunity. You could see a different kind of lectures. You can see me, you can see Ratnakar, you can see Chris, bringing all those evidences from all over the world. You see that? So that's a great asset for the students. And spend time when you are here, try to explore that. You can make 100 of questions. You can ask questions to us. We have a lot of to offer. We have to tell a whole thing about the public health, whatever we have got. And when you are here, be 100% physically and mentally, because this is a great time. You'll never have this great time again. When you are in university, just be in the university, just be with your study and be 100%, be honest to yourself, and then ask questions and just follow what we say, and then you will learn a lot of things. And we are in public health, and as we said, it's interdisciplinary. It doesn't mean that you just have to one information. It's interlinked. Public health is interlinked subjects. So great experienced teachers are here. Make use of it. So use it.
Thank you, Dev, and over to Ratnakar.
Thanks, Ranjit. So as they all know, we are an university of opportunity. So we provide all the opportunities for the students, and it is for them to utilize, to get the best out of their experience. So I think my top tip is for them is to have discipline. First and foremost thing, engage, hard work. I think these are the 3 important things which I would suggest to any student. Thanks, Ranjit.
Excellent, thank you. And I think if I was going to add something, it's probably just repeating what you've already said, but just a little phrase that I use myself, and that is little and often. And I think when you look at your studies, deal with it in little blocks, and things can feel difficult to begin with, but just break it down, and you'll find at the end of it, you'll look back and you'll think, okay, well, I don't really think I've done that much, but you'll be amazed. You'll get your degree, and hopefully you'll go on to do a master's. Chris actually leads the Master of Public Health course, so she'll welcome you onto that course afterwards, and then you might end up doing a PhD. So I think it's that start of that journey, little and often, little steps, and you'll get to where you want to get to. And enjoy it. We have lots of additional activities as well, and we want to have fun with you as well. So again, thank you to everyone. Thank you for everyone joining us. If you haven't made your choice yet, the number to call is 01902 518585, or go to the university website, which is wlv.ac.uk.
Thanks, Ranjit. Thanks, Chris.
Cool.
Thanks, Dev, and thanks for the participants. Have a good day. Thank you.
Cool.